Imagine waking up every day feeling tired. Even after 8 hours of sleep, your weight keeps increasing, even when you barely eat. Your periods become irregular. Your hair starts falling. Acne refuses to leave. And everyone says, it's normal. Don't overthink. But what if it's not normal? What if your body is screaming for help? Imagine your body as a beautifully designed orchestra. Every hormone is a musician. Every gland is an instrument. And when everything is in harmony, your body feels energetic, balanced, and strong. But when one instrument goes out of tune, the entire music changes. Today, we are talking about two silent hormonal disorders that are changing women's lives worldwide. That is exactly what happens in PCOS and thyroid disorders. Understanding hormones. Before understanding PCOS and thyroid, we must understand hormones. Hormones are chemical messengers. They control periods, weight, mood, energy, fertility, hair growth, skin, sleep. 1. Periods. They regulate ovulation and the menstrual cycle. If hormones are balanced, periods come regularly. If they are disturbed, periods become irregular, painful, or may even stop. 2. Weight. Hormones decide how your body stores fat and how fast you burn calories. Even if two people eat the same food, hormonal balance can make their bodies respond differently. 3. Mood. Ever felt emotional before your period? Or anxious without clear reason? Hormones like estrogen, progesterone, and thyroid hormones directly influence brain chemistry. They can affect happiness, anxiety, irritability, and even depression. 4. Energy. If your thyroid hormone is low, you may feel exhausted all the time, even after sleeping well. If it's high, you may feel restless and unable to relax. Energy is not just about sleep. It's about hormones. 5. Fertility. Hormones coordinate ovulation, egg development, and preparation of the uterus for pregnancy. Even a small imbalance can interfere with conception. 6. Hair growth. Excess androgens can cause unwanted facial hair. Thyroid imbalance can cause hair thinning. Healthy hormones mean healthy hair cycles. 7. Skin. Hormones control oil production. Imbalance can cause acne, dryness, pigmentation, or sensitivity. 8. Sleep. Melatonin, cortisol, thyroid hormones all play a role. If hormones are disturbed, sleep becomes light, broken, or insufficient. Now here is the powerful truth. When hormones are balanced, you don't even notice them. But when they are disturbed, your whole life feels different. That's why conditions like PCOS and thyroid disorders don't just affect one organ. They affect your confidence, your emotions, your relationships, your future plans. Hormones may be invisible, but their impact is deeply visible in a woman's life. When hormones are balanced, your body works smoothly. When hormones are disturbed, your entire system suffers. 2 major systems involved: ovaries, thyroid gland. And when these two go wrong, the impact is powerful. What is PCOS? PCOS stands for Polycystic Ovary Syndrome. It is a hormonal disorder affecting women of reproductive age. In PCOS, ovaries produce excess male hormones, androgens. Ovulation becomes irregular. Small, immature follicles accumulate in ovaries. Important: PCOS does not mean dangerous cysts. They are immature eggs that failed to mature. Causes of PCOS. There is no single cause, but major factors include insulin resistance, most common, genetics, obesity, chronic inflammation, sedentary lifestyle, stress. 1. Insulin resistance, most common cause. This is the main driver in most PCOS cases. Insulin is a hormone that helps move sugar from your blood into your cells for energy. But in insulin resistance, the body stops responding properly to insulin. The pancreas produces more insulin to compensate. High insulin levels stimulate the ovaries to produce excess male hormones, androgens. Ovulation becomes irregular. This leads to missed periods, weight gain, acne, facial hair. It becomes a vicious hormonal cycle. And here is something important. Many women with PCOS are not overeating. Their body is storing fat differently because of insulin imbalance. That changes everything. 2. Genetics. If your mother or sister has PCOS, your risk increases. There are genetic tendencies that affect Insulin sensitivity, hormone production, ovarian function. You didn't cause it. Sometimes your body is simply more sensitive to hormonal shifts. 3. Obesity. Excess body fat, especially around the abdomen, worsens insulin resistance. Fat tissue is not just storage, it is hormonally active. It produces inflammatory chemicals and influences estrogen levels. This can further disturb ovulation. But remember, obesity can worsen PCOS. PCOS can also cause weight gain. It is a two-way relationship. That's why blaming someone's weight without understanding hormones is unfair. 4. Chronic inflammation. Many women with PCOS have low-grade inflammation. Inflammation can stimulate the ovaries to produce more androgens. It can also worsen insulin resistance. Signs of chronic inflammation may not be obvious, but internally, the body is under stress. Diet high in processed foods, sugar, and lack of sleep can increase this inflammation. 5. Sedentary lifestyle. Lack of physical activity reduces insulin sensitivity. Muscles help use glucose effectively when we move less. Sugar stays longer in blood. Insulin increases. Hormonal imbalance worsens. Even simple walking daily can improve hormone regulation. Movement is medicine. 6. Stress. Stress is powerful. When you are stressed, your body releases cortisol. High cortisol levels increase blood sugar, worsen insulin resistance, disturb ovulation, affect sleep, emotional stress, academic pressure, relationship stress. All of it impacts hormones. The mind and ovaries are deeply connected. PCOS is not caused by one mistake. It is the result of multiple factors interacting with each other. And the good news? Many of these factors can be improved. Lifestyle changes, stress management, balanced diet, and medical support can slowly reverse the cycle. Healing does not happen overnight, but it happens. Insulin resistance is the key villain. When insulin increases, body stores more fat, ovaries produce more androgens, periods stop. It becomes a vicious cycle. Symptoms of PCOS: irregular or missed periods, weight gain, especially belly fat, acne, facial hair, hirsutism, hair thinning, infertility, mood swings, dark patches on neck, acanthosis nigricans. 1. Irregular or missed periods. This is often the first sign. In PCOS, ovulation does not happen regularly. When ovulation is irregular, periods become unpredictable. Cycles longer than 35 days. Skipping months. Very light bleeding, or sometimes very heavy bleeding. Many women think, it's normal, my cycle is just irregular. But persistent, irregular periods are not something to ignore. It is your body telling you that ovulation is not happening properly. 2. Weight gain, especially belly fat. This weight gain feels different. It often accumulates around the abdomen. Even with dieting, it becomes difficult to lose. Why? Because insulin resistance encourages the body to store fat, especially in the belly area. And unfortunately, belly fat further worsens insulin resistance. It becomes a frustrating cycle. This is why many women say, I barely eat, but I still gain weight. It's not just calories, it's hormones. 3. Acne. PCOS-related acne is usually persistent, deep, painful, located on the jawline or chin. This happens because excess androgens increase oil production in the skin. It's not teenage acne, it's hormonal acne, and it often affects confidence deeply. 4. Facial hair. Hirsutism. Excess male hormones stimulate hair growth in unwanted areas. Chin, upper lip, chest, abdomen. This symptom can be emotionally devastating. Many women feel embarrassed. Some avoid close social interaction. Some constantly wax or shave in silence. But this is a hormonal imbalance, not a personal flaw. 5. Hair thinning. While unwanted, hair increases on the face. Hair on the scalp may thin. This happens because androgens shrink hair follicles on the scalp. The irony is painful. More hair where you don't want it, less hair where you do. 6. Infertility. Because ovulation is irregular or absent, getting pregnant becomes difficult. But here is an important message. PCOS does not mean permanent infertility. It means ovulation needs support and regulation. With proper treatment, many women with PCOS conceive naturally or with minimal assistance. There is hope. 7. Mood swings. Hormonal fluctuations directly affect brain chemistry. Women with PCOS may experience anxiety, irritability, low mood, depression. It is not overreacting. Hormones influence neurotransmitters like serotonin. Mental health is part of hormonal health. 8. Dark patches on neck, acanthosis nigricans. These dark, thickened skin patches often appear on the back of the neck, underarms, groin. This is a strong sign of insulin resistance. It is not dirt. It is not poor hygiene. It is a metabolic signal from the body. If you recognize yourself in these symptoms, please understand this. Your body is not working against you. It is asking for balance. And once you understand what is happening, you stop blaming yourself and start healing yourself. Let me tell you a real story. Meet Aisha, 24 years old. Her periods stopped for 4 months. She gained 10 kilo in 1 year. Her relatives started saying she eats too much, but she barely ate. She cried alone because hair started growing on her chin. She stopped attending family functions. She felt less feminine. Finally, she was diagnosed with PCOS, and she realized it wasn't her fault. PCOS is not laziness. It is not lack of willpower. It is a medical condition. What is thyroid? The thyroid is a butterfly-shaped gland in the neck. It controls metabolism. It produces T3, triiodothyronine, T4, thyroxine, TSH, thyroid-stimulating hormone, from brain. Think of thyroid as your body's speed regulator. If thyroid is slow, everything slows down. If thyroid is fast, everything speeds up. Types of thyroid disorders: hypothyroidism, underactive thyroid; hyperthyroidism, overactive thyroid; autoimmune thyroid disorders: Hashimoto's thyroiditis, Graves' disease, hypothyroidism. Most common symptoms: weight gain, extreme fatigue, depression, constipation, hair fall, cold intolerance, puffy face, heavy periods. Hyperthyroidism symptoms: weight loss, anxiety, tremors, palpitations, heat intolerance, excess, sweating, irregular periods. Connection between PCOS and thyroid. Many women have both PCOS and thyroid disorder. Why? Because both are hormone-related. Both involve metabolism. Both involve insulin sensitivity. Hypothyroidism can worsen PCOS symptoms. If thyroid slows metabolism, weight increases, insulin resistance worsens, ovulation becomes more irregular. It becomes double hormonal imbalance. This is why testing thyroid in PCOS patients is important. Diagnosis: for PCOS, ultrasound, LH-FSH ratio, testosterone levels, fasting insulin, HbA1c. For thyroid, BSI, C3, T4, anti-TPO antibodies if autoimmune suspected. Important message: never self-diagnose from Google. Always consult a qualified doctor. Treatment. Now, the most important part. Can PCOS and thyroid be cured? Thyroid. Hypothyroidism, lifelong medication, levothyroxine. Hyperthyroidism, medicines, radioactive iodine, or surgery. PCOS. There is no permanent cure, but it can be controlled. PCOS management plan. Weight loss, even 5 to 10% improves ovulation. Low glycemic diet. Regular exercise. Metformin, if insulin resistance. Birth control pills, for cycle regulation. Anti-androgen medications. Fertility treatments, if required. Lifestyle is medicine. Diet advice: avoid refined sugar. Avoid white flour. Eat high-fiber food. Include protein in every meal. Omega-3 fatty acids. Vitamin D monitoring. Exercise plan: 30-45 minutes daily. Strength training. Walking. Yoga for stress. Stress increases cortisol. Cortisol worsens PCOS. Mind and hormones are connected. Emotional story. Another story. Sarah was told she may never become a mother. She was devastated. But she didn't give up. She improved her diet. She walked daily. She took medicines regularly. 1 year later, she held her baby in her arms. PCOS is not the end. Thyroid is not the end. It is a condition, not a destiny. Complications if untreated. PCOS complications: infertility, type 2 diabetes, endometrial cancer, depression, sleep apnea. Thyroid complications: heart disease, myxedema, coma, severe hypothyroidism, thyroid storm, severe hyperthyroidism. Ignoring symptoms can be dangerous. Final message: if you are struggling, please hear this carefully. You are not weak. You are not lazy. You are not broken. Your body is asking for balance. Get tested. Seek help. Change lifestyle. Be patient with yourself. Hormones heal slowly, but they heal. And if this video helps even one woman understand her body better, then it was worth it. If you found this helpful, share it with a sister, a friend, a daughter, because awareness saves lives. And remember, your health is your real wealth. Please, like, comment, subscribe,